Cancer is a major global health issue. 1 in 4 people at this conference will be diagnosed with cancer at some point in their life. Everybody at this conference will be impacted by it, whether it is through their own diagnosis or that of a friend, a family member, or a loved one. It is a genuinely global health issue that affects everyone, irrespective of socioeconomic class, race, geography. Unfortunately, despite all of the efforts that have been put in around the world to improve care, there's still one question that is the key determinant of what your treatment journey will look like. Will you go through and have a full recovery and go on to live the full life? Will you endure multiple rounds of chemotherapy and all of the adverse effects that come with that? And that question is, where do you live? Because unfortunately for cancer, where you live determines your access to a hospital that has the necessary diagnostic equipment and expertise to properly diagnose your cancer. It determines your access to a doctor who has the relevant experience for your individual type of cancer and your own condition. In short, our ability to improve cancer care is not a question of science. It's a question of the system. And fixing that system using AI is what we are trying to do at Avitia. So I grew up in Australia, which, at least back when I was a kid, had a healthcare system that was premised on the belief that everybody deserves care. And the system was designed to make sure that regardless of where you lived or what your own economic situation was, you had access to the care that was necessary in order to get better. That made a lot of sense to me as a kid and is a concept that has stuck with me ever since. Unfortunately, cancer is a really difficult one to apply that concept to, because whilst we like to look at it as a single condition or to break it down into broad buckets, cancer is a highly individualized disease. Each patient's cancer is ultimately different to the next person's. So a lung cancer patient and another lung cancer patient won't be the same. For doctors, even though they're trying to deliver on this concept that everyone deserves access to care, that's really hard to do. They're busy enough as it is, the systems are overburdened, and if you then need to look at each patient and each patient being very different to the next, how do you deal with that? The challenges they face because of these differences are many, but essentially the key ones are that getting a patient onto treatment is too slow because the diagnosis is complicated. The doctor has to look at the patient individually and go through each of their own insights and apply that to their own knowledge and do their own research. The expertise behind treating individual cancers is far too centralized. The experts who are the best at treating particular types of cancers inevitably work at major research institutions in the major cities. If you're unable to travel to Boston or to New York or to a major medical center, your chances of getting the care you need may be a lot lower. Ultimately, the problem is the way it works right now is it's just not an equal field for everyone to play on. So at Avitia, we knew that if we were going to address this issue with the system, we'd have to work within the parameters of a public health system. There's no point trying to go around it. We had to find a way to address this within the system in which we operated, which brought us to the ultimate realization that the key problem in making sure everyone had the ability to get the care they needed was access. Making sure that patients, regardless of where they are, could access the diagnosis and access the treatment that they needed to get care. So what we have built at Avitia is an AI-powered system that is intended to supplement and enhance the capabilities of laboratories and oncologists around the world, not to replace them. We've done this by focusing on having a distributed testing system that's based on a very simple blood draw. So no matter where you are, you just take a simple vial of blood, and that can be sent to either the laboratory in the hospital or a nearby lab for testing. Geographic access for the patient immediately addressed. We've also built a cloud-based, AI-powered bioinformatics platform so that no matter what cancers the doctor has seen, they have access to an entire global knowledge base of cancers that doctors across the network have had experience with. A doctor in rural Canada is able to access the insights from across the world on how to treat that particular patient's cancer. Expertise, as a result, is no longer centralized in large institutions. It can be accessed wherever the patient needs it. Best of all, this means that with these two barriers addressed, the ability of a patient to get personalized care for their cancer is now no longer limited by their ability to travel and where they're based. They can get that basically close to home and receive the personalized care that they need. The other advantage of the AI platform that we have built is it ensures that the treatment that is recommended for the patient is personalized to them. Not only does the distributed approach allow testing to occur wherever the patient needs it, it allows an ingestion of all of the different bits of data that occur during a cancer treatment journey. You're no longer reliant on a single form of analysis at a single point in time. You can take in the genetic testing from the patient, you can take in imaging data, you can look at their medical history, and piece together an individual view on what the patient's condition is, and more importantly, what is the best possible way to treat that particular patient. This can then be used to also trace how the patient's progressing. You'll no longer have a situation where a patient may undergo 3 months worth of treatment only to find the cancer has gotten worse. Blood testing and a distributed platform and AI allow us to look at the patient at regular intervals, assess whether or not they are responding to the treatment, and importantly, pivot that treatment when you find out that there's a resistance building or the patient, for some other reason, is just simply not responding. This makes a massive difference to the patient. I mean, no matter how good a cancer treatment is, it's not a pleasant experience for anybody. These are very serious drugs. They have got adverse effects if you're on the one that's not suitable for you, and they are expensive. Being able to make sure the patient's on the right drug that minimizes the adverse effects allows them to continue living their lives like normal. Cancer ceases being a fatal condition and instead becomes a chronic condition that can be managed. Importantly, it also saves resources for the system, allowing those to be better allocated elsewhere rather than being wasted on ineffective treatments. So this all sounds well and good, but the best part is this platform has been built and it has been deployed and validated. And it's not just been deployed in Canada. Patients all the way from Montreal down to Bangkok are now able to receive tests on our platform, and as a result are getting put on the right treatment for their particular cancer much faster. Processes that used to take weeks are now taking days, and patients are getting back through treatment and onto a better trajectory for recovery and an ability to live their life much faster. Since launching the platform, over 40,000 tests have been run on patients in 7 countries across 4 different continents. There's obviously been savings across the treatment pathway for healthcare systems, and importantly, oncologists have seen the results and been able to go, okay, we now understand the benefit that this can give to the patients and also to the oncologists. By allowing the patient to get treatment and diagnosis at their point of care rather than having to travel, they're essentially able to take control back over their lives. They're no longer having to uproot themselves and move solely to get treatment. They can continue on their life as normal and basically keep in control of the impact that cancer has on them. With June being National Cancer Survivor Month, Avitia is very proud to be working with Colorectal Cancer Canada to launch Speak Up for Cancer Care this month. We will work with them and patient groups to advocate for better access to patients in Canada to precision care and advanced diagnostics at or near their point of care. After all, it's crazy that the solution exists already and we're making people wait for the answers. We should simply let them have access to it. And so in closing, Avitia's focus has always been improving access for patients to the care that they need. And we think that by combining AI together with liquid biopsy and being able to deploy that on a distributed basis. Patients can now get access to the care they need without the inconveniences that have traditionally come with the cancer diagnosis. And importantly, go on to live their lives with cancer simply as a chronic condition that can be easily managed for them. Thank you.